We actually are providing more services than ever in Kent County as a hospice provider. And we're able to do that because we're larger. You know, there's some good and bad when you start thinking about expansion and how big you want to get as a community-based provider. And I think we're really right at the best size that a provider could possibly be at. We have enough patients in service area that we are able to expand our services and what we provide the community because we have the financial means to do so. But we're not large enough to lose that small town feel. And that's really where Compass Regional Hospice wants to stay as a regional provider. We have been out to, we're in all the local school systems. We're providing grief counseling in the local school systems. A lot of people don't equate hospice to providing that, but we have a large community-based grief service program that provides grief support to anybody who has experienced a loss. In Kent County, as well as Queen Anne's and Caroline County. So that is anybody who has experienced a suicide in their family, maybe a loss or a death from a car accident. Unfortunately, in our day and age, heroin and drug overdoses. So we do a lot of counseling one-on-one for that. We also have group support groups in the community, some at the local churches. And again, as I was speaking to the public school systems, our counselors go into the schools while the kids are there so that they're not having to be taken out of school, but they have one-on-one counseling with them there. They may have lost a friend in a car accident. They may have lost a parent. And so we provide all these services in all 3 counties, but we're talking about Kent now, free of charge. And so we do have to count on the community at large to provide fundraising dollars for us or donations so that we can continue to do those type of great works. Our board and leadership team just had an off-site strategic planning session, and a big part of the conversation was how and where can we put beds in Kent County so that Kent County residents don't have to leave Kent County to come to Centerville or to Denton, because we have a 3-bedroom facility in Denton as well, so that they can stay in their community. And be in a home-like setting, a home away from home. So not necessarily a nursing home bed or an assisted living bed. So our goal is to have 2 to 3 beds in Kent County. We are still in the research or investigation process with some of the local facilities in Kent County of where we could potentially renovate some beds. Because one thing that I think a lot of people don't understand is, well, we'd have to fundraise 100% of money to put beds in Kent County. So Kent County residents will have to come beside us and support us in doing that in order to make it happen. But it's not just getting the beds there initially, it's maintaining a building and being able to staff it 24 hours a day, 7 days a week. And the staffing is really the most expensive piece of the puzzle for that. So it would be ongoing funding that we would need support with through the community. But we're looking at different, maybe assisted living facilities or nursing home facilities, really in particular, that we could partner with them and we could have an entrance and exit that was not the main entrance to their building, and that we would renovate kind of like a small little wing and be able to have a hospice facility there within our already existing facility. Hospice industry is, I would say we're kind of like Gumby now. We've learned how to be so flexible over the last probably 10 years, I'd say mostly, because every single year our industry gets more regulated. So I think that we're in a good position as an industry in hospice, that we're willing to change. We know that change is inevitable. And what we do is we just step up for the quality of care that we feel that needs to be provided, not only in the state of Maryland, but in our country. We're all very involved with our National Hospice and Palliative Care organization that is out of Alexandria, Virginia. They do an awful lot of research for us and making sure that we are cutting edge and that we know the regulations and what's happening in the legislative environment that's going to affect hospice and our industry, as well as the Maryland Hospice Palliative Network of Maryland. I sit on the board. I am the vice chair of that. We actually have our annual conference tomorrow in Turf Valley. So I think there might be changes because of our new president, but there's been so many changes over the last several years that we'll just roll with the punches and we'll continue to provide stellar hospice services to our communities. If I had a magic wand and I could wave it and change one thing right now, it would be the general public's knowledge and acceptance of end-of-life care, and in particular hospice and palliative care, and that it is a continuum of health care and it's not for the last couple days of life, and that it is quality health care. And I think it's amazing that all of our communities in Maryland have hospices, and that I think the communities ought to be privileged and proud and get behind the hospices and support not only the mission and financially support, but support in the fact that it's not this scary thing that shouldn't be talked about anymore, but it is an integral part of healthcare today.